enough intro, and I'll have Jennifer Semaras, who's come to us, introduce herself and tell us more about what she does.
Good afternoon, everyone. Thank you for having me here today. I'm Jen Semaras. I'm a licensed health insurance advisor. I actually do a little work at the MGH Neuromuscular Clinic. So I was asked here today to present on the insurance aspect of everything and diseases and anything I can help with, basically, from a national perspective. So I basically have a mass health background for about 11 years, as well as a commercial health insurance. I worked in their third-party liability and formed a company a couple years ago. So we're basically reaching out nationally. So I've picked up some additional knowledge about national health insurance, as well as Medicaid programs, particular to various states, the southern part of the country. But I'd like to make this interactive, so if you have any questions after each slide, please feel free to raise your hand. I know that we're represented here from a wide range of countries as well as states. And again, I try to make this nationally based to provide a high-level overview of health insurance in general, and basically advise you on what options and what are your best options for health insurance. Am I doing this right? All right. Yeah, wrong way. There we go. So who in this room has employer-sponsored health insurance? Good, that's good to see, because you were pretty much in the same bucket with the other 149 million Americans. It is the widest utilized health insurance that we have in this country. We have private insurance, which often falls into the same bucket, but private insurance, in the insurance side of the house, we basically view it as health insurance exchanges or through the health insurance brokers. Anybody acquire their health insurance through their exchange, their state exchange? Okay, we'll leave that one off the plate then. We got Medicare, which is over 65 or disability related. And then we've got Medicaid, which is the financial and categorically eligible categories. And we'll get into the Medicaid piece of it, because it's actually a great program to have as a secondary insurance, and there's additional benefits to Medicaid by having Medicaid, or for Medicaid. So the premiums, yes, everyone has probably seen their premiums go up a little bit over the past couple of years. It's the way the employer is starting to cost share with employees. So basically, your premiums might have gone up 10, 20%. Sometimes these they're subsidized, obviously, by the employer. So having employer-sponsored health insurance is the most reasonable type of health insurance as of right now, because your employer in most instances subsidize a percentage, if not the whole thing, which is not as common as it used to be. So your co-pays, those are your fixed dollar amount where the insured will pay for a portion of the healthcare service or the pharmacy benefit. Usually happens, you go to your doctor, you pay a 20, 30, 40, I'm starting to see $50 co-pays. Then you get your deductibles. Again, these are climbing, and we can thank the Affordable Care Act, since they actually put levels of the deductibles and how far up they can go. And basically what it allowed insurance companies to do is say, oh great, the federal government's basically raising our deductibles, so we're going to raise them too. And again, it's more of the cost sharing being placed on the insured. So the deductibles basically is what you are required to pay for the cost of insurance before the insurance company will pay. And some of these deductibles range anywhere between $2,000 for an individual of upwards of $6,000 for a family. So that's basically what you've got to pay out of pocket before your insurance actually pays. The co-insurance, that's the amount of the percentage amount of a covered medical costs. Usually it's an 80%, 20%, which means your insurance company will pay for 80% of the covered amount of the service, and then you're responsible for 20%. And then we got our out-of-pocket maximum, which is basically the safety. You finally hit your out-of-pocket maximum, and those pretty much can range up to about $12,000 per year. So I'm sure everybody in this room can attest to the fact that health insurance is expensive, and it's increasingly expensive. And unfortunately, there's not a ton of options out there to mitigate these types of costs. There's really no end in sight unless somebody comes in, it's president, and says, guess what, we're going to make a single payer system, and we're going to treat it somewhat like Medicare. But there are options, in which we'll get into, of how to basically look for secondary and coverage, or get secondary and coverage. So how do you optimize your health insurance? Paying less in premiums, believe it or not, or actually paying less in premiums usually means paying more in out-of-pocket costs. So I should actually flip this sentence, right? If you pay more in premiums, you're going to pay less in out-of-pocket costs. So maybe an extra $100 or $200 per month in your health insurance, by increasing that premium, you might not have to pay a $6,000 deductible. That deductible might go down to $4,000. Your co-pays might get reduced as well if you upfront premiums. So if you pay more upfront, your co-pays and your deductibles and your co-insurance amounts will usually go down as a result of, again, paying more upfront. And I usually tell everybody, do a cost-benefit analysis on what you're actually paying in premiums versus what the out-of-pocket expenses are. You might actually save a lot of money, again, by just paying additional amounts in the premiums up front. And then you want to compare your plans. So you could have a couple of options through your employer, or you could have a multitude of options. And the same thing with Medicaid as well. A lot of the Medicaid programs now are moving to managed care, where you have multiple options of Medicaid plans. So you want to take a look at what you can actually get out of your Medicaid managed care, as well as your employer-sponsored health insurance or your exchange plan. And then the other thing is the continuity of care. So I wrote down, think before you ink, right? If you ever think about changing your health insurance, make sure that your current providers actually accept that health insurance. It's imperative. The last thing you want to do is enroll to a new health insurance and then provide the card to your primary care physician or your specialist, and they basically tell you flat out, oh, guess what, we don't accept this insurance. So check with all your providers before you change health insurance. And I know employers these days are dropping certain carriers as a result of their costliness. And they actually might enroll you into a plan, or they might only give you one or two options for various health insurance carriers. Again, before you change, check with your providers. Even check with your pharmacists or your pharmacy to make sure that any scripts that you take, any drugs that you take, are actually covered by that insurance. Each health insurance has drug formularies associated with it. So if you're taking either a brand name drug, if you're taking a brand name drug, that drug formulary might be different under a different health insurance plan. So it's just something to consider, actually something you want to look at if you ever change health insurance plans. And then with high utilizers of healthcare, companies often have case managers. The insurance companies have case managers to coordinate care and services. So if you're having issues getting certain services covered or getting scripts covered, contact your health insurance company and ask them for a case manager. What they can do is actually administratively coordinate your care, and they're assigned to you, and oftentimes it will give you their direct number, and you can work with them on a number of issues that you encounter. So utilizing Medicaid. So everybody knows about the Affordable Care Act, right? It was basically implemented back in 2010. Now 2014 came by. Some states actually expanded Medicaid. Everyone's required to have health insurance. What actually has been relatively helpful for states, whether or not they expanded Medicaid or not, to actually increase rolls into Medicaid. So maybe prior to January 2014, eligibility into this program was really difficult. But now there's actually increases in what we call the federal poverty level. So you might have been making, so basically what it is more people can get on Medicaid as a result of higher income brackets. And it's all based on your annual income. It's also a streamlined application, which I'm going to kind of laugh a little bit about, because if anyone here is from the state of Massachusetts, it's been nothing but a nightmare. But most states actually have a streamlined application where you can go online and apply for benefits, and you can actually get a somewhat instantaneous acknowledgement or decision from the Medicaid program. Some states haven't quite gotten there yet, but you still can apply. It costs nothing to go online and do it. Or you can actually, if you're receiving services from a provider, you can actually contact a financial counselor or ask at registration to speak to a financial counselor, and they actually will be able to assist you applying for Medicaid. And then there's actually the disability portion too of Medicaid, which has been kind of a myth in a lot of states because most people look at Medicaid as an income-based program. But certain states for children have what they call Katie Beckett or Katie Mulligan programs, and they're programs that are carved out for children that have disabilities that relate to the Social Security. So Social Security is sort of a federal program, and they have a guide of disabilities that enable individuals to get onto Medicaid. And so these Katie Beckett programs, or these Katie Mulligan programs, again, are carved out for disabled children. They don't look at, in most states, they don't look at income for the family. They might look at income for the actual patient or the child themselves. And those amounts could be, dependent on the state. But it's worth looking into. If you're here in Massachusetts, we have a common health program. And that program does look at the entire household income. However, being disabled qualifies you for common health, regardless of what your income is. And again, certain states have these Katie Beckett programs, which, again, just look at the income of the child. And it's having Medicaid as secondary will help with all of what we discussed about the co-pays, the co-insurance, and the deductibles, because Medicaid is secondary, and it therefore wraps everything that the commercial health insurance doesn't cover, or all your out-of-pockets. And there are also waiver programs, too. So states, through their Medicaid programs, can apply for waivers. And waivers are usually disease-specific, or there's, all kinds of waivers in this state. But we won't even get into it. But there's a lot of states, again, you can apply for waiver programs. You have to be deemed Medicaid eligible. But the waiver programs can provide additional services that maybe the commercial doesn't cover or Medicaid doesn't cover. And again, these waiver programs are phenomenal to have because there's certain service like private duty nursing that they'll cover. They'll cover sometimes daycare. So it's always worth looking into for waiver programs in Medicaid. And you'll find all this information if you just basically type it into your state and you just bring up your state's Medicaid programs. There's plothers of information on there. And as a result of the Affordable Care Act, states have to be more transparent with their reporting as well as their forms and documents online. So Medicaid is primary. You've got a couple options. There's the Medicaid fee-for-service program, which basically is you go to the hospital, you show them your Medicaid card, and it's the provider essentially bills Medicaid and gets paid. You can pretty much go anywhere with a Medicaid fee-for-service product. And then again, a lot of states are moving to the Medicaid managed care model. These models get a little more complicated in how they're structured because oftentimes what will happen is certain regions of your state will go ahead and contract with the Medicaid MCOs. So maybe if you're in the western part of the state, you might have 2 or 3 Medicaid managed cares that are contracted with the provider that you see. However, if you go to the eastern section of the state to go see a provider, they might not necessarily take your Medicaid managed care. So usually in instances like that, I recommend people just to go to the Medicaid fee-for-service if they can. Otherwise, what would have to happen is you'd actually have to change out of your managed care just to go see a provider in the eastern section of the state. So it's just something to be cognitive about. But you do get a few more benefits with a Medicaid managed care. They usually provide wellness benefits in addition to car seats and bike helmets, a couple other additional services. And then out-of-state and Medicaid. So most states, if you have Medicaid and you want to go to a provider external to your state, you can go ahead and do so. However, if you decide to move out of your state to another state, you are going to have to reapply for Medicaid. There is no translation of Medicaids between states. So basically what you'd have to do is go, if you move from South Carolina to North Carolina, you'd have to actually end your South Carolina Medicaid and then go ahead and apply for North Carolina Medicaid. And again, as a result of Medicaid being state-specific, there could be differentials in income guidelines or differentials in some of how they view their disability. And I'm probably going too fast, and I hope this is educational for everybody and you're absorbing some of how fast I'm going. But given 20 minutes, it's kind of tough. But I'm working it here. Does anyone have any questions? I'm just going to take an intermediary pause. Anything? Yes, go.
Can you mention how you go about it if you want to go to, say you have a leukodystrophy, and so you want to go seek a specialized provider that's not in your network, how you go about doing that?
Sure. Sure. So Katie mentioned if you want to go see an out-of-network provider, how do you go about doing that? For a specialty.
Very specialized medical problem.
So if you have a specialized medical problem, how do you seek treatment out of network? So most commercial health insurance plans have out-of-network benefits. It costs more. But ideally what you'd want to do is, first of all, you contact that provider that you want to go see, and you ask them if they accept your health insurance. You basically provide them your card information, your group number, and they'll run it through their system or their contracts, and they'll tell you yes or no. In most cases, if you have a preferred provider organization or a point of service type of policy, it's automatically accepted. If you have a health maintenance organization, you might run into a couple of issues. But regardless, contact that provider and ensure that they accept your health insurance. Then I would make a call to your health insurer and basically tell them that you're going to this provider and how much is it going to cost you out of pocket amounts, and if you're going to have any patient pay responsibilities. So that's basically how you deal with that.
But do you sometimes get an exemption? So we have patients that are not covered. So there are patients that are not covered, but because there's not a leukodystrophy clinic in their network, you can fight it and get coverage.
Yeah, you can.
Right. So that's what I wanted
right.
people to know.
You work with that all the time, don't you?
Yeah, but it's from you because you're the expert.
No, yeah, you can. You can. If they're the insurance company, you basically explain to the insurance company as a result of no area providers or perform the services for leukodystrophies, and you want to go to Mass General and you're coming down from Maine, you basically get an exemption in place so you can get the services you need. And in fact, the same thing works too with even going cross country. If there's services that you need, and your existing provider or an area provider doesn't offer them, again, you get that exemption form, and you get your services that you need. And that actually gets involved in more of the coordination of benefits piece of it. How to. I hope everybody in this room, or most of everyone in this room, keeps track of their health insurance summary of benefits and their explanation of benefits, because it's important to know what's covered, what you've been paying out of pocket, and you track that information. Does anyone do that, or does everybody do that? It's a good idea. You can just literally get a binder and put everything you get from the insurance company right in a binder and track it on a spreadsheet. But you want to know how much you're paying for your health care. And it's good because you literally could get, if you need a secondary health insurance, Medicaid, because you're paid $10,000, you paid $16,000 out of pocket. I mean, those are what some of the out-of-pocket maximums are going to now. You'd want to get a secondary insurance just to pick up that amount. It's exorbitant. Yeah.
The thing with health insurance and any insurance is, which I know that's not.
I can hear you, though.
No, we need all the questions on the microphone so the webcast and the video recording catches them.
Do you want to take that one to them, Lauren?
I can walk over.
Hello? Okay. There we go. So, but the problem I have is just you're not really going to have an answer that is going to really appease it. But we have to pay insurance whether we use our benefits or not, right? And we have to spend all this money every month, shell out for something that we're not going to use until the time comes. And so, I mean, I don't know. I just look at like insurance companies, and any insurance companies just milk the people until we have a need to use the coverage, and then we have to pay. So whether we keep track of it or not, we're paying them anyway. So why do we have to keep track of it? They're taking our money regardless if we have to go to the doctor or not.
So before I answer this question, does anyone here work for health insurance companies?
I'd like to talk to you after
I'm
this.
with you. I don't work for health insurance companies. They're probably, nobody in this room probably even likes them. We all have headaches from health insurance companies. And I'd be lying to you if I said that we don't pay for uninsured individuals or for those who have expensive medical conditions. We all take the brunt of that. But regardless, every insurance company has to have guaranteed issuance, which means that you buy their policy, they have to provide it to you. And they have to guarantee renewability. So after a year goes by, they cannot drop you off of health insurance. But you also have to think, too, that accidents in life happen, right? You could walk down the street and something catastrophic could happen. And the last thing you want to do is be in a bed with a $100,000 bill. So insurance accounts for that.
Well, of course, that's the defense. I mean, you don't want to be without it. You never know. But I realize, like, the question is not really suited to get an answer that's going to be like, oh, yeah, I get it. That makes sense. I mean, I realize that's just the way it is. But more importantly, and I don't know if it's the right time for this, but something that really bothers me about health insurance is that there is no initial price list for any coverages when you're at the doctor.
So that's going to change. Not physicians, but hospitals. So you can actually do, their price transparency is coming out. In this state, it's actually required. They passed a law in 2012, I think, where you can actually now shop for coverage. So you can contact the provider, give them your insurance company information, and they can actually, by law, they are required to tell you how much a procedure is going to cost with an estimated out-of-pocket of what you can expect based on your health insurance.
Well, estimate is what it is now, isn't it?
I'm sorry.
Like estimated cost? They give you an estimate.
They give you they
I
cannot.
want a price.
So the reason why they can't give you the price is because of complications that can occur during the treatment.
Yeah, there's I understand. I've experienced it.
Yeah.
But it's like
why aspirins cost $15 a pop, all that. Yeah.
But it's like the only place in the world where you don't know what you're actually paying for before you buy the service.
Correct.
I mean, it doesn't make any sense. 2015. Why isn't there a better system? I mean, you were talking about spreadsheets and a binder. It's 2015.
But that's
I'm just saying,
that's
like
for
in
you.
general.
Correct.
I'm just saying the concept of why we're not more advanced as more diseases become more prevalent, as humans have evolved into carrying more diseases. Why hasn't health insurance adapted to that and gotten more, updated with their systems and
so they just passed
they
just passed ICD-10 yesterday, and that's actually going to help place more. It's going to help as far as identifying more diseases in a larger spectrum, more specific. I think there was some ridiculous amount of ICD-10 codes added in this past one, but we are behind the times with that. No two ways about it. Europe has had ICD-10, I think, for the past 2 decades or a decade and a half. But yeah, I agree. There's a lot of administrative costs associated with healthcare that interjects into the care and quality. There's no two ways about it. And will it get fixed? I think sometimes the politics kind of get in the way of things getting fixed and being more efficient and effective. But I think there's, the healthcare industry has been kind of in our archaic sort of mode the past decade or two. And now things are just starting to really, get more in IT-ish. You're starting to see electronic medical records. Someone here is going to be talking about the patient portal. You can actually access some of your medical record information right off the internet. But it also, when you do that, you're starting to compromise your medical information because now it's out there. And there's been, breaches on that. So there's just, it's a highly, we're not as sophisticated as a financial industry yet, but we're getting there. And, in time, I think, hopefully, either we end up just imploding or things get fixed. But good questions.
Thank you.
Okay, am I good with time? Okay. All right, so I think I'm going backwards again. Yeah. Okay, so out-of-pocket coordination of benefits. All right, so here's Medicaid. I'm going to move to this one. Okay, so here's, this is actually my specialty. Okay, so you got Medicaid, right? Whether it's primary or secondary. There's actually a program out here called the Health Insurance Premium Payment Program, and about 36 states have this. And what they basically do is they'll reimburse you for your cost of health insurance premiums. So as long as somebody in the household has Medicaid and there's a policyholder that has access to health insurance. Again, depending on the state, it could be employer-sponsored health insurance or it could be private insurance that you either get through a broker or through the health insurance exchange. Programs vary. They're not publicized programs. They're administratively complex, but they're helpful. They'll literally pay you for your health insurance. And the states actually love it, even though they don't publicize it, because it's a cost containment program. It's a lot less expensive for the state to go ahead and pay you for your health insurance premiums as opposed to paying out claims, especially for medically complex. And it's a beneficial for the Medicaid beneficiary, the family, the taxpayers, the states, and the providers. And you can basically do a Google search in your on your computer, and you can type in your state as well as a health insurance premium payment program or premium assistance, and it'll let you know if there's a program in your state. Massachusetts, I know there's people from California. I believe they have a program. New York has a program. Maine has a program, and New Hampshire has a program. Anybody want to raise their hand? I can tell you. Texas, huge program, huge health insurance premium payment program. Florida has one for children only. That Republican state, I'm telling you. Oregon, yes, Oregon has a state, and Oregon's very advanced in their healthcare insurance, and they're proactive. At least they were about a year ago. Okay, so resources. Again, Google's great. You can type in anything and everything in Google, and you pretty much get a 99.9% accuracy hit. You can go on your state website. Again, if you're looking to get Medicaid secondary, I just say fill out the application. If you could do it online, fill it out, see what happens. The worst that can happen is they deny you. The best is that you're accepted into the program. Social Security also is a good resource. There's plenty of information on there. When you reach the age of 18, I believe, yeah, you can actually apply for Social Security benefits. It's income-based. There's Medicare. I mean, there's all kinds of, we could spend days on this. And then the Center for Medicaid and Medicare Services. So they're the overseers of the Medicare and Medicaid programs. And again, they have a plethora of information on there and lots of resources, especially if you have Medicare and Medicaid. There's information on the coordination benefits. So thanks for having me. And you know, if you have any questions, I guess we'll figure out a way to get to them.
Thanks, Jen. That was great. I usually think of controversial subjects being in biology, not in insurance. So, but that's great to have that highlighted. And if there are no immediate questions, we'll move on to Katie Weigel. Excellent. But I would think of this as resources. As a resource, you want to get back to INA or ALD Connect with questions about insurance that we can help get answered with Jen's help. I'm seeing Jen now as part of our family and an ongoing resource for the future. So be warned, you'll be pulled into webinars and other things you can help with. So